Welcome to this explainer. Today, we're diving deep into the reality of migraines, uncovering the actual neurological life cycle of these attacks based on comprehensive medical data. Listen, if you or someone you know battles with these, you already know the profound impact they can have. But today, we're going to look under the hood. We're going to map out exactly what is happening inside the brain, tracking this condition much like a meteorologist tracks a severe storm.
Right off the bat, let's bust a massive myth. A migraine is not, I repeat, not just a standard headache. It's a severe neurological event. Actually, it's one of the most common neurological disorders worldwide. It completely hijacks your nervous system, often bringing life, work, and everything else to a grinding halt.
So here is our roadmap for today's explainer. First, more than just a headache. Second, triggers, types, and warnings. Third, the 4 stages of attack. And finally, diagnosis, treatment, and prevention. Let's jump into section 1, more than just a headache.
The absolute crucial point to understand here is that a migraine is basically your brain on overdrive. It involves hyperactive pain pathways and major shifts in neurotransmitters like serotonin. It's this abnormal surge of activity that fundamentally alters how your nerves and blood vessels function. So the pain, it isn't just a symptom. It's the result of a fascinating yet completely agonizing cascade of neurological misfires that can derail your day or even your week.
Now, you might be wondering, why does this happen? Well, a singular, exact cause is still kind of a medical mystery, but the foundation of the disorder is a mix of genetic predispositions and those neurotransmitter changes we just mentioned. You'll also notice hormonal fluctuations play a massive role here. That perfectly explains why this disorder is significantly more common in women than in men, often kicking off during adolescence or early adulthood when hormones are rapidly shifting.
Moving right along to section 2, triggers, types, and warnings. Identifying the specific sparks that set off an attack is absolutely vital. Triggers vary wildly from person to person, almost frustratingly so. We're talking environmental factors like harsh weather changes, bright lights, or strong smells. Then there are daily lifestyle habits, sleep deprivation, dehydration, or just skipping a meal. Even beloved foods like aged cheese, chocolate, or too much caffeine can trigger that abnormal brain activity. Identifying your personal trigger is for sure your first line of defense. And just like triggers, not all migraines are identical. Migraine without aura is the most common, hitting you without obvious warning signs, but there are some highly specific variations. Vestibular migraines involve intense dizziness. Chronic sufferers, they battle these debilitating symptoms on 15 or more days every single month. There are even hemiplegic migraines that cause temporary weakness on one side of the body. Which brings us to section 3, the 4 stages of attack. You see, a migraine isn't just a single, isolated event. It's an entire life cycle broken down into 4 distinct phases: prodrome, aura, headache, and postdrome. Let's break these down one by one so you know exactly what's happening. Stage 1 is the prodrome phase. The physical toll actually starts hours or even days before the pain ever hits. Think of this as the sky turning green before a tornado. It acts as an early warning system. People might experience profound fatigue, totally unexplained mood changes, strange food cravings, or severe neck stiffness. If you know what to look for, this phase is actually a crucial window to prepare yourself or even medicate. Next up is the aura phase, which happens in some, but definitely not all patients. This is a highly specific neurological phenomenon lasting anywhere from 5 to 60 minutes right before the headache starts. People describe seeing vivid visual disturbances, like flashing lights, blind spots, or zigzag patterns across their vision. It's almost like a glitching computer screen. It can even cause tingling, numbness, or temporary difficulty speaking. It's a clear indicator that the brain's pathways are going into overdrive. Then the main event hits, the headache phase. This is what most people immediately associate with a migraine. A patient endures anywhere from 4 to a staggering 72 hours of severe, pulsating, usually one-sided pain. But it's rarely just pain, right? It's often accompanied by intense nausea, vomiting, and an agonizing sensitivity to light, sound, and sometimes even smells. The brain is just entirely overwhelmed. Eventually, the pain subsides, but the storm leaves a serious wake of destruction. This is the postdrome phase, and it can last for another 24 to 48 hours. Patients often refer to this as a migraine hangover. It's characterized by profound weakness, totally draining fatigue, and a heavy brain fog where just trying to concentrate feels nearly impossible. The attack has completely drained the body's resources. All right, let's talk solutions in Section 4, diagnosis, treatment, and prevention.
But first, we really have to acknowledge the red flags. Because migraines share symptoms with other conditions, we absolutely must rule out emergencies. Symptoms like a sudden, explosive pain, often described as the literal worst headache of your life, or one-sided weakness, loss of consciousness, seizures, or high fever require urgent medical care. These can indicate severe, life-threatening conditions, like a stroke or meningitis, so don't ignore them.
Okay, so once you're safely diagnosed through symptom tracking, maybe a headache diary, and scans to exclude other causes, doctors usually tackle this on two fronts. First, acute treatments taken right during an attack. Things like triptans, which specifically target migraine pathways, along with paracetamol and anti-nausea meds. Second, for folks with frequent attacks, preventive daily prescriptions. These range from blood pressure meds like propranolol to amitriptyline, all the way to advanced CGRP-targeted medications designed specifically to stop migraines before they even start. But hey, pills aren't the only answer here. Empowering lifestyle modifications and physiotherapy play a massive, proven role in reducing how often these attacks happen. Correcting your posture, doing cervical mobility exercises, and stretching can relieve the muscle tension that feeds right into those overactive pain pathways. Combine that with rigorous sleep hygiene, staying hydrated, and managing stress, you're building an incredibly strong defense system. Which naturally brings us to the ultimate question for anyone watching this explainer who suffers from these devastating neurological storms. Can a migraine actually be cured, once and for all?
Well, the honest, medically accurate answer is that right now there is no permanent cure. However, the medical consensus is incredibly optimistic. Identifying your personal triggers, catching the disorder early, and strictly sticking to a personalized treatment and lifestyle plan provides highly effective, totally life-changing control. You might not be able to stop the weather, but you can absolutely build a stronger house.
I think this quote sums it up perfectly. Migraines are so often misunderstood, but they do not have to dictate your life. By recognizing your triggers and building the right medical defenses, you take the power back. So the next time the sky turns green, are you going to be a victim of the storm or will you be ready for it? Thanks for joining me on this explainer. Keep tracking and take control.